there, everyone. I'm Dr. Andrea Schnowske from AlignLife Peoria. We are located here in the Metro Center in Peoria, Illinois, and we're really dedicated to educating you a little bit more about how your body works and also how it heals so that you know exactly what your body is trying to tell you and decode what those little messages mean from your body. So this month is all about heart health, and today's video, I want to talk a little bit more about statin medication. So a lot of people don't realize this, but when we take statin medications over a long period of time to help lower cholesterol, it can actually change how your body normally works, change the fact that your body actually uses cholesterol for a lot of different health just functions. And to top it off, those medications, when we take them over a long period of time and even a short period of time, actually can damage normal body systems. So some of the most common statin medications that we hear about are Lipitor, Zocor, or Crestor, or some of the more common names for those are atorvastatin, simvastatin, and rosuvastatin. And those are statin medications that are typically prescribed by your doctor when your cholesterol levels are too high. Now, we're going to talk a little bit more in a different video about what cholesterol numbers mean, how to decode what they mean, and also some different things you can do with diet and exercise, and even understanding if maybe your liver needs a little extra support getting rid of cholesterol. Because in some cases, when your cholesterol numbers are out of range, that just means your body is having trouble getting rid of that cholesterol. So we can do some things with helping to support or heal liver damage that may have been done previously to get those levels back down to normal. So what I want to do today is kind of talk a little bit more about statin medications, the fact that they are overused, and when you're taking them long-term, they can cause some pretty serious side effects. So when we think about statin medications, they are probably one of the probably most common medications that are prescribed by doctors. And actually, in the year 2010, we spent $37 billion just in the US on statin medications. All three of the more common medications for statins, such as I mentioned before, which is the Lipitor, the Zocor, and the Crestor, two of those three are actually in the top 10 best-selling drugs in the United States. So they're very commonly used. They're one of the more expensive drugs as well. So I want to talk a little bit more about what they do. So statin medications, when we take those, they actually will block your body's liver production of cholesterol. Now, I want to remind you that cholesterol is used in your body to make your hormones. So if you are having hormone balance issues, statin medications in many cases, because they are interfering with those steroid hormones, that can actually cause hormone imbalance and cause you to have a lack of testosterone, estrogen, or progesterone as a result of that. The other thing they do is they actually block an enzyme in your body that helps make cholesterol. So cholesterol is used in addition to those steroid hormones. It's also used to make up your brain and also coat your nerves and protect those from damage. So if you are suffering from any neuropathies or nerve pain, if you're suffering from numbness and tingling, that may be a symptom of the fact that your nerves are not getting that myelin sheath, which is made of cholesterol, to protect them. So when we're looking at statin medications over a long period of time, we may start to see issues where neuropathy is a side effect of that. In addition, we can also see where that statin medication will interfere with your body's production of CoQ10, which is actually it's a nutrient that we get from our food, but your body is also able to absorb that from things you eat. But that's actually used for antioxidants, so helping with any type of antioxidant stress and healing in your body, but that's also responsible for the energy production. So we've actually seen some side effects of statin medications where it caused mitochondrial damage. So we had not only fatigue as a result of that, but we also had some issues with muscle disorders and muscle wasting, where muscles just were not working properly. But the other thing too is cholesterol is necessary in order for your body to turn vitamin D into an active form. So in many cases, if you're on a statin medication and your body's not able to turn vitamin D into an active form, not only can you get vitamin D deficiency, but that's going to interfere with your bone health. It's going to interfere with your muscle production. It's going to interfere with your immune system as well. So it's really important to understand that when you take a statin medication, that medication is a chemical. It changes how your body normally works. So it can interfere, in addition to causing cholesterol production to be slowed down in the liver, it can also block CoQ10 production. It can block vitamin D production. It can block hormone function. It can affect your brain and nerve function as well. So it's really important to understand that there are side effects. So usually I recommend, if your doctor is recommending that you go on a statin medication, I would definitely talk to your doctor about trying to do a 90-day program of diet and exercise, which we'll talk a little bit more about some other things you can do in addition to that to help lower your cholesterol level without medication. But also understanding that if you do need to go on one, we want to try to get that level back into normal range and find out ways that we can keep that in range naturally. So if you are taking a statin medication, I usually recommend you don't want to be on it for more than 3 years. Some of the studies are actually showing that if you do have to go on a statin medication, a lower dosage is always the best, and then increase that if necessary. For most people, a 2.5 milligram dosage is sufficient from what the research is suggesting. When you do higher dosages, you're more likely to have liver and kidney damage, as well as muscle damage from that. Columbia University did a study, and they actually found that if we take 80 milligrams in about 30 days, that CoQ10 production, like I mentioned, for energy, that actually goes down by 50%. So if we can use a smaller dosage, which there was a study in Japan, they showed that if we did a 10 milligrams, so a smaller dosage for 8 weeks, we still had a reduction of 40% in that CoQ10. So if you have to be on a statin medication, you want to make sure you're doing the lowest dose possible, increasing up if necessary, and working with your doctor on that. But it is definitely more beneficial to try 90 days of diet and exercise, as well as some supportive supplements if necessary to help your body get that back in range. Now, some of the side effects of statins, so if you've been on statins for a while, or if you know somebody that is currently talking to the doctor about possibly adding that in to their prescription regimen, you will want to be aware that there can be side effects of liver and kidney injury and damage. We can also have mitochondrial damage, where our body's energy sources can be exhausted. We can also see nerve damage and neuropathy from that, so nerve pain, sharp shooting, tingling, numbness, that sort of thing. We can also see muscle weakness, which is a really important one. If you start having muscle weakness or start noticing that your muscles are not responding as well, or you're starting to get tremors, you want to talk to your doctor right away. You could be having a serious side effect of that statin medication. Another thing to look out for is if you are having some issues with blood sugar balance or you are diabetic, when we are taking a statin medication, that's actually going to increase insulin resistance, which will make diabetes a little harder to manage. Another thing to keep in mind, because that statin is going to change nerve function and brain function, we can also see some memory issues start up. So if we're having any issues with memory loss, if we're having any issues with Alzheimer's, dementia, Parkinson's, those can all be linked to statin medication long-term use too. So again, if you know anybody that is on a statin medication and wants to get off, a lot of times we'll actually call and work with your doctor's office doing 90 days of diet and exercise guided by our office, as well as some recommendation for nutritional changes or supplements that can help assist in that process. So if you know anybody that is dealing with statins or is thinking about getting on one of those, make sure they watch this video so they learn a little bit more about what statins do and some of the side effects and how they actually affect your body. If you have any questions, or if you want to come into our office, sit down, talk a little bit more about what we can do to look at your cholesterol numbers, what they actually mean, which we're going to do another video talking about what those cholesterol numbers mean, and then also talking about what cholesterol does in the body and lowering those numbers naturally with diet, exercise, and supplementation. So if you have any questions, give our office a call, 309-689-6200. Again, I'm Dr. Andrea Schnowske. I'm a chiropractor, but I also do quite a bit of functional medicine in my office. I want you to be educated about your health and how your body works so that you can really embrace a healthier lifestyle and really listen to what your body's trying to tell you. So have a great rest of your day, and hopefully you learned something today.